See, I got a prospect from Cambodia. He's a healthcare provider.
Yeah.
Show me this picture of his patient, diabetic womb, like, you know, the two leg, you see, the two already like this. So he asking specifically,
My God.
Yeah.
specifically, how would he use the METADICHOL? How many times spray on the leg and how many times spray on the mouth?
Mhm.
You know, you see this.
This sort of problem, all right. Number one, I must remind everybody, you know, do not stop them from seeing a doctor because the leg, you know, may be infected. In the infection can kill the patient as well, you know. So now let us be responsible, all right. Share with them, of course. You can spray into your mouth like any other patient. Number two, you know, if you have CRP, what you can do is this: dilute CRP. Maybe the nerve ending already died. They may have no, the patient may have no more sensation, may not have the pain sensation anymore. He can use a very sort of dilute some CRP. Maybe like, you know, one small spray, add 20-30 drops of CRP and spray onto the wound, and also spray METADICHOL on the wound as well. I strongly recommend him to take, other than METADICHOL, take CRP and also gamat, jerry gamat, because, you know, it promotes cell growth. Now, bear in mind that people who have a high glucose in the blood, couples with the problems of inflammation and also blockages of capillary. Now, it is always a problem for diabetic patients to heal their wounds, okay? Because high blood glucose will affect protein synthesis, it will affect fat synthesis, it will attract the bacteria called Clostridium bacteria. So, you know, he got to go for treatment in the hospital or clinic or whatever while using METADICHOL and CRP and also gamat. Okay.
Thank you.
Yeah. Now, METADICHOL helps diabetic patients in multiple ways. One of the sort of mechanism is actually it binds. Okay, it up. Or it activates or it binds with this so-called as this GPR120 receptor. All right, and this is important because this GPR120 receptor will modulate insulin secretion. It will regulate the glucose metabolism, having the property of anti-inflammation, increase insulin sensitivity, and also reduce the obesity. So the mechanism why METADICHOL helps a diabetic patient is because of GPR120. And the second reason is because of METADICHOL binds with the VDR, this vitamin B receptor, which will modulate the so-called as glucose homeostasis. Now, the third mechanism is because METADICHOL actually increase the secretion of adiponectin, and this will also increase in insulin sensitivity, having the property of anti-inflammation, reduce obesity, prevent blockages, and also, you know, lower the production of glucose, either from glycogen or non-carbohydrate sort of a source of glucose. Now also increase the usage of glucose, all right, in our body. So and this adiponectin also can protect our beta cell, liver beta cell. Okay, so there are multiple pathway or mechanism how METADICHOL helps to prevent diabetic patient or to prevent deterioration of diabetic patient. All right.
As you have heard from Benson, what an amazing product, METADICHOL is one product that will take care of a lot of health disorders. Have you come across one before? It is expensive.
There are a few questions here from the chat. One is that it can help insulin resistance. Yeah, because either the GPR120 or adiponectin also increase, insulin sensitivity. Okay. Another question here is that, all right, do I have to watch out our diet when consume the product? Now, you still continue your life, or consume a diet like before, or your habit of eating like before. Even if you are taking METADICHOL, even if you are taking medicine, you still can go ahead. Now, let me highlight this again. METADICHOL has no contraindication with any kind of health issue. METADICHOL has no drug interaction issue. You still can take METADICHOL regardless of what medicine you are taking.
I would like to ask a question. My name is Bhavani. I'd like to know whether METADICHOL is patented with the Ministry of Health Malaysia. Does it come under health or beauty?
For a product, when we submit to Health Ministry, okay, now first, whether it's topical or oral consumption, okay. Now, if they say it's topical use, then you need to have so-called notification approval. When it is for oral consumption, we have to submit to Health Ministry, to MPRA, for them to classify. All right. When they classify, basically what we can sell is only 3 categories. All right. Beyond that, medicines or drug is not something that we can promote. So now METADICHOL is classified under so-called as food drug interface. All right, because it may be under food, it may be under food drug interface, it may be under health supplement. So to answer your question, it is classified under food drug interface.
Sure. So you cannot say that it treats diabetes and kidney disease and everything, because it doesn't come under medication and treatment under the Ministry of Health.
You are right. You are right.
Thank you.
Now, one of the reasons why, since you are in the medical line, I think you also know very well, for anything that qualified to be so-called as a medicine, they have to go through all the clinical study, long clinical study according to the medical protocol. All right. No individual or small organization can do it, because it may cost billions and billions and probably takes like 10 years or more. That is the reason why some scientists, who come up with some product, at the end of the day, they will be acquired by those pharmaceutical company, not to produce it, but sometimes they just destroy it. I mean, yes. Under FDI, yeah.
Okay. Thank you, Mr. Benson. I know it's under it's FDA approved, right?
Yeah. All right.
Okay. All right. Thank you.
Thank you. Okay, there's a question here. I think very important for us to understand, because there should be a KKM hologram. Let me explain to you what is KKM, so that people won't make mistake, because many people talk about KKM. KKM here is approval of label. All right. If the product is classified under food or FDI, then there is no hologram like for health supplement. Okay, please take note. Yeah. Okay. So don't mistaken between the health supplement, which we normally call it requires MAL. Then there will be a MAL number and also the hologram from for MAL. Okay, for food and FDI is not fall under this category. Thank you. Now, is METADICHOL patented in Malaysia under Ministry of Health patent? Now let us understand this again, because patent is handled by different department by patent. So is not. May not be had under Health Ministry.
Excuse me, I'm from Hong Kong.
Yeah.
Mr. Benson, I have a question I want to ask that. I was heard that METADICHOL can have successful cases for the people to get rid of COVID, HIV, from positive to negative. Is there any cases? Is it true?
Okay, I even have the photo of the patient in my phone, but I think it's unethical to share her photo. Actually, there are about more than 10 candidates, using METADICHOL, and there are only 2 cases where one of the cases I don't have the info actually stand forward, to share their testimony with their test report. We are not talking about, the AIDS, where the AIDS symptom, HIV symptom disappeared or cure, but we are talking about the HIV positive, turn negative. All right. She's very kind. She want to help, and she actually shared with us about her photo. Yes, there are cases of HIV cases turn negative. Yes. But I would not want to share her photo. Yeah.
Okay. And how about the diabetes? Is there the cases? Were they successfully healed completely, or the symptoms get less?
Okay. I think for diabetic patient, it's very important for us to look into various biomarkers other than blood glucose. According to this UK study, probably I don't know whether this William can share the testimony. Actually, the METADICHOL do have a study on diabetic patient. Now, based on UK study, okay. Now, the study on diabetic patient, do show that it greatly improved, for diabetic studies. Okay, it really improved the different biomarkers. Okay, this is something very interesting. All right. Now you can see that, according to this study in UK. Another slide, please, up or down. Yeah, this UK PDS, study for 10 years, over 5,000 diabetic patients. Now, the reduce of this slight reduce of blood pressure and other biomarkers can actually greatly reduce the possibility of diabetic complication. Now, based on the so-called, and now you go back to the next slide. Okay. Now, this is a study on the 14 diabetic patients for 12 weeks. Now, most of the chronic diseases, actually, the optimum effect comes in between 3 to 6 months. Now, you can see that actually the fasting glucose, reduced not so significant, but I think for diabetic patient, C-reactive protein, blood pressure, lipid profile, all right, all these are important biomarkers that we have to be careful as well. So actually, METADICHOL not only reduce the fasting glucose, but it also lower the ESR, EGFR, creatinine, C-reactive protein. All right, it is on average. Next slide. We can say that METADICHOL, based on the study, reduce the overall complication and the risk by about 40 to 50%.
That means for the patient, they take continually and constantly for a period of time, let's say around probably it's half year, the result will be much better. Am I right?
Yeah, because, I mean, of course, it depends on individuals. I did ask Dr. Raghu before, because I give an example, there's a gentleman my age, from Penang, Dato Sri in Malaysia. All right, he's so excited because after taking METADICHOL for a month, he stopped his metformin, and I think his metformin is quite high dosage, 500 mg, two tablets, twice a day. So he stopped metformin, and the from 12. This the glucose level is used to be 12, now reduced to on the 12th of June, the glucose level reduced to 4.6, and on the 13th, if I'm not wrong, it is at the level. Yeah, this is the reading. Okay, so he's very excited to share, and he don't mind to record video. This gentleman is 63 years old. Right? So, but bear in mind, we cannot claim that everybody will get the same benefit. All right. We also cannot claim that everybody will get a benefit within such a short period of time. Now, there will be many people after taking for years, they still have to continue with that medication. Now, bear in mind, do not ask anybody to stop medication. All right. Now, that is not our job. That is the job of doctor. We are not competitor of doctor. We are not competitor to any medicine. All right. We are just helping, supplementing. All right. It's just a supplement. For some people, they can see the effect within days. For some people, they may take months. For some people, it may not really help. I give you an example. METADICHOL was first conducted the clinical study in India on high blood pressure. Okay. On the second day, the assistant, who are helping, to conduct the study, is so shocked that it seems that after one day, all the candidates, the blood pressure reduced. So Dr. Raghu went to the center on the second or third day, I can't really remember, and further, the blood pressure further reduced. All right, so it is quite shocking. All right, but okay, okay, this is the center where the study is conducted, is it? All right. So what happened is this. I did ask this Dr. Raghu why some people see the benefits so fast and some people don't. Now, according to Dr. Raghu, this product is like an intelligent supplement. It will solve the problem in accordance to the priority where the problem needs to be solved. Now, what I mean here is this. We may take this product for diabetic or for high blood pressure, but this product will probably don't go and solve the problem, but solve other problems first, before it can actually solve your problem. This is the answer that Dr. Raghu gave it to me. So yeah, maybe, traditional approach and the so-called modern medication sort of understanding, maybe, a bit of gap there. But the ultimate is that, yeah, we are benefited. Let me share with you, I'm 63 years old, like many old men, I had urination problem. It seems that I lost the strength to squeeze out the urine. But after, so that's why, when we go to the public toilet, we are a bit embarrassed because we tend to stand there for a long period of time to wait for the urine to come out. But after taking METADICHOL for days, it gone. And until now, I've been taking METADICHOL for about, I think, 10 or 11 months. Most people who have frequent urination can be as high as, they have to wake up 8 times a night to urine, or some 5-6 times after taking METADICHOL. Most of them see the benefit within 1 to 2 weeks time. And it comes along with some side effect. I mean, when I say side effect is that, be it they are at the 60s, 50s, or 70s, most of them experience the improvement of erectile function. Okay, obvious. This is fast and obvious. It also helps to clear my about 2 years coughing problem. I went for X-ray, and after taking METADICHOL, I forget about my cough until my wife one day woke up to me and asked me, hey, for some time, I never hear you coughing. Then only I realized I forgotten to cough. All right. I had my medical checkup every day, not every day, every year, all right, because I'm not the healthy as I look like, since young. So I was diagnosed with many kind of health issue. I also aware, I think I removed more than 10 polyps for sure. I have 40 over diverticulum in my colon. Of course, I can remove the polyp, but I can't do much with my diverticulum, and then it causes inflammation to the extent that I asked my doctor, possible to remove my colon, but they say the diverticulum is spread all over my colon. I can't do much. After taking METADICHOL, what it helps me is it reduces the suffering of inflammation to the extent every morning also I take Nastamat now. Okay, right. But of course, I don't take too spicy. Yeah. I have mild fatty liver before COVID, diagnosed with mild fatty liver. After COVID, I went for medical checkup again. I asked the doctor, how's the condition? He said, I did my checkup 4 years ago before COVID in Thompson Hospital next to my office. And after COVID, I went to iHeal at the Mid-Valley. I asked the doctor, you don't have fatty liver. I have heart blockages, 3 blockages, mild blockages since long ago, I think 8 years ago, 50%, 35 and 20% calcified blockages. And then 4 years ago, I went for another checkup, CT scan, same thing, 50, 35, 20. I'm happy because it didn't get worse. To me, this is not something that can go away. But after COVID, I went for another CT scan, still there, but reduced. I'm quite shocked. I even question myself, maybe because they make an error in measurement, reduced from 50 to 50, 15, and 10%. I mean, now, this is something that a surprise to me. Anyway, okay, thank you very much.
And also, please excuse me, I just want to ask that I saw some already the product existed 1 year ago, right? It's being selling from different country, but it's not under your company, am I right?
I wouldn't be able to answer things that are not under sold by us. I can only say that we sell generic product imported from Switzerland. All right, the rest, how they alter the formulation.
Yes.
We cannot answer it because we really don't know. And today, as you know that online everything can happen. All right.
Okay. Thank you.
All right. Thank you.
Hello, my brother-in-law grandniece, 10-year-old girl having autism. So they want autism.
Yeah.
So they wanted her to use METADICHOL. So how would one use on the message, on the dosage? And then I know that you have a few cases of people improve autism using METADICHOL. Can you elaborate?
Okay, now for autism or some mild mental issue, there is a report. I'm not sure already been published or not, because Dr. Raghu is going to publish another report on mental issues. All right. There are cases like those who have a bipolar issue after using METADICHOL, not in Malaysia, that was in overseas, that see very much improvement. I have testimonies from Puchong, all right, where the family has 2 children with autism. Now, after using METADICHOL, the parents say 70% improved, but I can't explain what does it mean 70% improve. All right. Now, so in terms of dosage, all right, now it is. Now, let me put it this way, there is no issue of overdose, but it doesn't mean that you have to use as much as possible. Let's look into the cost effectiveness. Now, 10 years old, I think if we continue with like, 5 spray 2-3 times a day, that will be sufficient.
Okay, thank you.
Yeah, thanks.
And she cannot roll up her tongue, She refused to roll up her tongue to get the METADICHOL. Can we just spray onto the tongue?
No, it's okay. You can spray into the mouth. Spray under the tongue is because the blood vessel is quite on the surface. Can be easily absorbed. And then METADICHOL, you can just spray into the mouth. Right.
Okay, thank you.
Yeah.
Well, let me share something or two. All right, right? I'm 76 years old. All right, I'm still young, right? Benson says that you're never old. You're never old when you're taking METADICHOL. You're very right, Benson. I feel very young. Okay, I have this urination problem from 5 a night to 1. Now I get up once a night. Allergy problem for a few years already. It is solved. I used to sneeze. Once I sneeze, I continue sneezing. Now stop. No more. I got skin problem. All taken care of. Energy wise, it is fantastic. I have lots and loads of energy. I can now even wash a car. Imagine at 76 washing a car. I can jog, I can run, I can do a lot of things. I can squat, I can kneel, whatever it is. All right. Even my hair dropping has reduced. I noticed my hair dropping has reduced. Look at me, huh? Quite a lot of hair still on my head. Now I have arthritis, okay, on my fingers, my toes, right? I've got this, I've got a stomach. I eat a lot. But apparently I think METADICHOL is helping me to retain that stomach bloatedness, I've not put on any weight on the stomach, even though I ate a lot, okay? And my HP, my heart blood pressure, also I think it's quite, I did take for 2 days, okay? The last 2 days, I did not take it. It was 120, 125, 122. That's it. And today, of course, I started taking again. Because Benson said, you must not stop your medication. You must continue until the doctor says so. So what it says, I started taking since April the 11th. So today, probably about 10 weeks. And I have benefited so many, already. So to me I've never come across one product that can help me solve so many health issues. One product, okay? So I can urge you, ladies and gentlemen, if you are not on the product yet, please try. When you try it, you will experience the fantastic benefits that you will get. That I can assure you. All right. So at 76, well, look at me, still young, right? So I'm very happy with METADICHOL, all right? And I hope all others will feel the same way.
Okay, yeah, good afternoon, everyone. Actually, I was very hesitant to try anything until our friend Sunny invited me to listen. I listen. Okay. And one fine day, he asked me, you must come to the HQ to attend the physical meeting. I said, okay, I make a point. One day I went there. So while I was there, actually, it was very irritable. And towards the end, and that was the first time I saw the CEO, Benson. I saw one young man taking video. I didn't know he was William. Okay. And then I went off. I cannot tahan in Malay. We say cannot tahan anymore. The itch. I cannot scratch there. The more if I touch, it will spread further because I got the sudden skin allergy that happened actually 2 years back. And I have to see doctor to take antihistamine because I applied so many things, it couldn't help. And I have to take stronger one for at night to sleep. And the cream that he gave me, after 1 week, nothing helps. So I went back to see him. Oh, in this case, I give you a stronger one. I say, okay. So I came back and then I start applying. Only one application and it stops. I was like, wow, this doctor fantastic. He's my family doctor, very good. Then not knowing that it contains steroid until of late, I kept the cream. I didn't throw it away. It's still not yet expired. So I happened to have the same thing. Then I took out, I have a look first. wow, it contains steroids, so I dare not touch it. I throw it away. And I bought so many natural lotion and cream or whatever from the pharmacy. When I apply it, it settled a little while, then it come back again. So it's very unbearable. At night, I cannot sleep properly. You know, if it happened on one side of the hand, inner arm, the other inner arm also, left side, right side will do. The leg as well. So it's so terrible, you know. And then I have no choice. When then I told Sunny, he asked me, how's the meeting? I said, no, yesterday I have to go. I will feel very irritable. Then he said, why didn't you tell me? I can pass you the bottle there. I said, how do I know? I have to rush for another appointment. And next day he brought that bottle for me. So, okay, I started to try and dilute some, as he said, in a small bottle, and I sprayed on the infected area, and I feel so cooling. Not only that, and the irritation slowly went off. And of course, I sprayed, I don't know, 3 times a day, 5 sprays on my under my tongue. And I said, oh, after a few days, after actually the irritation when I spray it cooling, but after I took, and it came back a bit itch again, then I said, I think probably it's healing crisis, but I didn't tell him until he asked me. I said, yeah, it gets worse a little while. But I said, oh, it's healing crisis. I said, I understand because I have been in the health industry for a long time. So after a week plus, and everything was getting settled. That is my personal testimony, and I'm really thankful that I found this product because it's unbearable. You know, those who suffer this kind of skin irritation. And also my son, second one, my son, his face, I think also probably allergy or what, I don't know. It was red patch beside the lip, you know, on the one side, especially on the right side, left side, sorry. And I thought maybe some redness or whatever. I didn't bother until at night. So I went to look at him. The lighting is not very good, so I used my mobile to take a picture and enlarge it. The red patches, that there are so many spots, and on top of that looks like a past life. Then I see it looks like shingle, Chinese shingle, also similar type. I just said, okay, you wait, mommy, go and take the thing to spray for you. And I sprayed 2 sprays, one side, both sides are a little bit on the left, right side, more on the left side. And I said, okay, you sleep. Then next night before I sleep, I check again. I took a picture again. The redness is still there, but the yellow past light is almost gone. I said, mommy, spray for you again. Total, I sprayed for him 3 nights. And now perfectly okay. And last Saturday, went for hiking. He came back. The whole face was so red. So red. I thought maybe it's under the hot sun, but it's not. I think it's some reaction. So I also sprayed on his whole face. And Saturday was red. Sunday, perfectly okay. I sprayed for him at night before he sleep. That was the thing. But this one, the last one, I forgotten to take picture. So I have nothing to show. Next day, I will send the testimony. Okay, thank you.
Thank you, Belinda. And there's another testimony I want to see. I'm sure you have friends who are suffering from hemorrhoids. Piles? Well, those who have got piles, good news for you, because I have been suffering for the past 7 years, piles, hemorrhoids. I've got 4 swellings, okay? And recently, maybe a week or 2 weeks ago, I felt it was 3 swellings. Okay, when I go for motion, of course, sometimes blood comes out, right? The good news is this. The swellings have gone down tremendously. And you know, hemorrhoids, you got to push it in, right? Now, I used to take about 10 minutes to push them all in, suffering like hell. Now, this morning, I look at the watch clock there. It took me about 2 minutes and there's no pain at all. The swelling has gone down tremendously, and I believe maybe another 1 month, 2 months, the hemorrhoids will disappear. Imagine that. I'm not suffering now. So those who are their friends who are suffering from hemorrhoids, tell them to take this. I only took this today, probably about 10 weeks only. I've tried so many other things. It never helped. There's one machine, the blower machine. I used that for 3 years it never helped me at all. I used this METADICHOL for 10 weeks. It has helped me tremendously. And imagine, I've got so many other things which I will share with you later on. Okay. So now, anybody else?
Okay, there is a question here. Am I heard it right that there are cases no improvement seen after consuming this product? Okay, there are two questions. There's another question is that when is you can start to see the benefit. Let me answer the second question first. When we use METADICHOL, METADICHOL start to give rise to the benefit, but it cannot be equated as noticeable benefits. All right. Now it started to improve, to give our body the benefits, but it may not be noticeable. All right. So it depends on individual. Some may feel the benefit, some may not feel the benefit. So this also answers the second question. Some people don't feel anything at all. Yes. I think I've been taking health supplements since very young time. I would say that almost all supplements I never feel anything except for this METADICHOL. Okay, so yes, even if a person do not feel anything, it doesn't mean that the product is not working on them, but not to the extent that it's noticeable. Okay, all right. So and we can't say for sure. How long will you see the benefit? It really works. I mean, it really different from people to people. Even medicine do not. I mean, it's not. It cannot be assured of. Everybody get the same benefit within the same period of time. Okay.
The point here is, Benson.
Yeah.
When we consume METADICHOL, it goes into our body.
Yeah.
Right? Internally. And
Yeah.
I'm sure anybody that takes METADICHOL will find some benefit. Definitely. Because some people say, it will not work on me. Straight away they say in the mind here, it will not work on me. So it may not work on them. But if you are positive enough, you say that, this one, I finally found something that is fantastic. I'm sure this will help. Definitely it will help. It has helped. I have so many members with me. So far, there's none who come and tell me it never worked on me. Everybody enjoys some benefits, that's for sure. Just try it. Some may take one bottle, expect that something to happen with one bottle. No. You've been taking medication or supplements for years. It may not have happened also. But here, you take one bottle and you expect something to happen to you. Some people may need 2 or 3 bottles. I've so far, since April 21st, I've used 4 bottles. 10 weeks, I've used 4 bottles. That's all, Yes, it will work.
Okay.
It's,
based on the studies, the optimum benefit normally, between 3 to 6 months time. All right. Say that, for example, for this prostate problem, it may take as long as 6 to 9 months time. For HIV patient that turns negative, it actually takes about 17 months time to change from positive to negative. So it really depends on the health issue and also depends on individual's health condition. All right. Now, some benefit you may not notice it at all. You may take METADICHOL because of hypertension, but it may actually prevented you from develop into some other kind of diseases. It's all possible. Yeah.
METADICHOL will boost our immune system tremendously.
My name is Shashi. I'm from Penang. And I became a member. And my first shipment of METADICHOL came in on the 12th of June. That was last week. I haven't taken this and tried this. I am taking my genome tablets for my diabetes. My level is not very high. It's not 10 or 12, but I'm taking every day. I also sometimes break the case and everything. But I tell you, this 1 week that I take, I will show you my results. I took on the 12th of June, that's Monday, 1 tablet. Mine is 50 over 1,000 grams, genome extra in the morning, you know. And then the shipment came about 1 something or 2 something. I opened the shipment and Lego 2 spray inside. 2 spray. Then I drove all the way to Sitiawan. On the 13th, on Tuesday, on the 14th, Wednesday, on the 15th, Thursday, I did not take a single my tablet genome, but I only sprayed 5 sprays twice a day, twice a day, 5 sprays. And then on the 16th morning, at 8:30 a.m., I took my reading, and my reading was at 5.8. How it happened, I do not know. I didn't know, I'm telling you. I was there taking my food, the normal food. Yes, I don't drink. Before I was drinking, now I don't drink. I don't smoke. All that I stopped. But this, getting to 5.8, I said to myself, this guy is something crazy. So I challenged myself again now. I challenged myself. I said, let's continue this. On the 16th, that's Friday, I did not take genome. On the 17th, on Saturday, I did not take genome, but I was on 5 sprays 3 times a day. Now I increased 3 times a day because my good old friend Sunny told me, hey, you increase it to what they call to 3 times. I say, okay, 5 sprays 3 times, let's continue. I do it. And then, you know what, I tell you frankly speaking, let me just look at it, 5 spray, okay. Then on the Saturday, I came back. Then I said to myself, hey, I feel like eating durian. So I went to take durian, I spent $50, street fruits I bought together for my wife. I ate durian on Friday, that means on the 16th, on the 17th, and on the 16th, 17th, and 18th. 18 was yesterday. Okay? I just did durian. Then on Sunday, I never for my dinner, I take durian and I took ubi kayu. Ubi kayu, ubi kayu is a topic. You got it?
Yep.
And this morning, I said, I want to check. And my sugar level was what? Imagine, how many days I never take my genome, was 8.1. So it went up, right?
Yes.
It went up. From 5, it went up. Imagine I will never take my genome for more than few days. I still at 8, which is still controllable now.
With durians.
With the durian, and maybe it's not that. But again, I'm telling you, what I'm trying to say to you is that method, it helps you. It doesn't cure. You still have to control your medicine. What I'm telling you, that's what my message is. All right. So I will continue to do that. I'm now taking my data every day, and see. It takes some time. And I'm speaking to you. In 2002, I went from 2022, for 24th of February 2022, I went for a major operation, a very big operation. In fact, I got lymphomia. I can't even pronounce the word because my tongue is still dry. I'm taking this went for my operation, cancerous. I took it out, everything is done. I went for my CT scan. I went for my everything is completely done. But my throat and everything, my numbness here, my pain here, I'm still taking the METADICHOL and it helps me. I'm only a few days only, not even 1 month, But there is a lot of responses, good responses towards my body. I can assure you that. So don't be discouraged. You don't expect things to happen tomorrow morning. And I was thinking, you look at the cow. It's a beautiful animal, You look at them, the floor don't make anybody disturb anybody. It doesn't do anything. It just eat and eat grass. He tired, he sit down and rest. But he just by eating grass, he produces the calcium, milk. The best milk comes from calcium. How did it happen, sir? How did that happen? What does he eat? He doesn't eat anything, right? Only the grass. How does it happen? Because there's something in his body God created to make sure that it activates something to come out another byproduct. That is what our body is supposed to do. It takes some time because we are 60 plus, 70, something inside our body is already dead. So we got to reactivate the whole thing.
Number one is that we are arranging with Dr. Raghu to have a Zoom session with all of you. All right. It can be a bit technical, but you may ask any question. I think Dr. Raghu is more than willing to answer your question. This is number one. Number two is, I think it's still very important for us to abide to this as far as possible, that do not stop our medicine, but with the advice of doctor. I think it's very important, okay, because some of the medicine you cannot just simply stop. I mean, I think it's important. Depends on what kind of medication that you are taking. So even though METADICHOL, it works like miracle, but we still got to follow the right sort of advice. We still have to believe in doctor. We still need to take medicine prescribed by a doctor. Now, if you want to reduce your medicine, please do discuss with your doctor. Okay, thank you very much.